going to be your nurse today. How's it going?
Good.
Let me just wash my hands really quick. Before we get started, I just want to check your name and date of birth on your wristband. Can you verify that for me?
It is Mannequin for 1993.
Okay, perfect. That is what I have on your chart. So I'm here today to just do a head-to-toe assessment on you. Is that okay?
Yes.
Perfect. And can I just ask you really quick how you got to the hospital today?
I rode my bike.
Okay, great. So right off the bat, I'm just noting my patient's general appearance. I walked in the room. Patient's skin color looks great for their ethnicity. They seem to be alert and oriented. They responded appropriately. Their mobility seems to be healthy if they were able to ride their bike to the hospital. And I'm not noticing any signs of distress, no bleeding, no trouble breathing, and no deformities or anything like that. I do notice that my patient has an IV line in, but during shift report, it was noted that that was recently checked and is intact, and I will assess that as we go throughout the assessment. Okay, so I'm here to do that head-to-toe assessment like we talked about. And before we get started, I just want to obtain a height and weight on you. So I've obtained a height and weight. Patient is approximately 6 foot and about 72 kilograms, so about 160 pounds. So moving on, I'd want to go right into our skin assessment. And so I'm going to be looking at your skin throughout our assessment, but I just want to check a few things right now. So I'd want to check skin turgor on my patient. You can check that on the forearm, sometimes the back of the hand, and sometimes under the collarbone. And on our patient, they have excellent skin turgor, no signs of dehydration there. To the touch, the skin is warm and dry. I'm not noticing any signs of edema, and I can check capillary refill, and it is normal. I want to check both sides. Be careful with this side because we have that IV line in, and it doesn't look irritated. Dressing looks clean, and the line appears to be flowing well. So we check our capillary refill there. Both sides were less than 3 seconds, so that's good. And then I just want to roll you over and check your backside for any lesions or things like that. Is that okay?
Yes.
Okay, we just check the backside for anything that looks red or irritated. I'm not noticing any problems back here, so I help roll my patient back over. Okay, perfect. Now, I just want to move on to our head assessment. So I'm going to grab a pair of gloves. And I'm just going to palpate your face and scalp a little bit and look in your eyes, ears, and nose. Is that okay with you?
Yes.
Okay, so I'd be touching the patient, looking for any abrasions, scabs, lesions, things like that. Asking the patient if they feel any pain. Do you feel any pain when I touch your head?
No.
Okay, things look good there, nothing abnormal. So, moving on, I would like to assess patient's ears and hearing. So, I would like to just do a little hearing test. When I rub my fingers together, will you tell me which ear you hear it in?
Right. Left.
Okay, perfect. Hearing is functional bilaterally. And then I would like to check the ears for drainage. So I'm not seeing anything abnormal in either ear so far. They look symmetric and no excessive earwax or anything like that. So I want to move on to the eyes. So we could use a Snellen chart to assess vision, and we can also check the vision field. So I'd have my patient look at me and stare right at my nose and tell me how many fingers you see in each field. So okay, perfect. Patient seems to be functional in all 4 fields of vision, and I would just want to assess for any drainage, irritation, things like that in the eyes. And then I would do just a light check to check for pupils being equal and reactive to light bilaterally. And both pupils constrict when exposed to light, both are round and equal. So things look great with the eyes. Now, are you having any problems swallowing, any sores in your mouth, or any things I should know about your teeth?
No.
Okay, so I'd want to look in there, check mucous membranes, check gums and teeth for bleeding, lesions, things like that. This patient's oral cavity looks pink and moist and healthy. Can you smile for me? Patient's smile appears equal on both sides. And then I'm just going to palpate your trachea on your throat. Is that okay?
Yes.
Okay. Patient's trachea feels center, midline, so that's great. That's what we want. So moving on, I'm just going to check your lungs, do a little bit of a respiratory assessment. That involves me sitting you up and listening to lung sounds on your back, okay?
Okay.
So let me just clean my stethoscope. Okay. Okay, and then I'm just going to help sit you up. So, okay, and then we're just going to listen for 10 seconds. And I'm just going to listen on your sides as well. Last one. Okay. So your lungs sound healthy. While I was listening, I counted 12 breaths per minute, and that's within a normal range. It's also in accordance with the baseline that I've seen in your chart. And I didn't notice any work of breathing that was abnormal. Lung sounds were equal bilaterally and clear, so that's great. Before we move on, I'm just going to place my hands on your chest to check chest rise and fall. So go ahead and take a deep breath for me. Great. Okay, so the chest rose equally on both sides, and that's what we're looking for. So are you having any respiratory problems, cough? Are you coughing up anything, asthma, things like that?
No.
Okay, great. So now I'm just going to take a look at your heart. I'm going to take a listen, and I'm going to have to pull down the left side of your gown. Is that okay?
Yes.
Okay. Okay. So, sorry, I'm trying to keep you covered up for the most part. So, I'm going to locate the PMI on this patient, which is on the left side, midclavicular line, and about right here under the left pec. Okay, So now I'm just going to take a listen to that point for 30 seconds. Okay, and I'm going to move up to the pulmonic site, which is midclavicular line, 5th intercostal space. About right there. Listen for 30 seconds. Okay. Your heart sounds really healthy. The rate was 72 beats per minute, which is within normal range, and it's also really close to what was documented in your chart earlier, so that is great that you're staying consistent. And I just want to compare that rate and rhythm to your radial pulses, so I'm going to just feel those for 15 seconds. Okay, those feel strong and healthy, about a +2. The rate and rhythm match what I just listened to. And while I was there, I did assess for skin temperature and edema. Once again, he still feels normal and healthy in that area. And so, moving on, I just want to assess your upper extremities. So, I want to check skin, and we already talked about this IV. I'm not noticing any other abrasions or things like that. And I'm just going to assess some strength. So can I just have you squeeze both my fingers? Good. Now can you pull my hands towards you? Great. Can you push them away? Great. Okay. So patient feels strong equally on both sides, which is good. And is it okay if I take a look at your belly now? We're just going to move on down and check out the abdomen.
Yes.
Okay, are you having any GI problems?
No.
Okay, and when was your last bowel movement?
Today.
Okay, was it normal?
Yes.
Any pain upon having bowel movements?
No.
Okay. So I'm just going to take a look at the abdomen. It looks healthy, no lesions, abrasions, things like that, which is great. So I'm just going to go ahead and take a listen. Make sure everything's moving around down there. Okay, so abdomen sounds active in all 4 quadrants, which means things are moving around down there, and that's what we want. Is it okay if I just palpate your belly?
Yes.
Will you let me know if you feel any pain or tenderness?
Yes.
Okay. I palpate there. Anything there?
Nope.
How about over here?
Nope.
Okay, how about down here?
Nope.
And over here?
Nope.
Okay. Everything feels normal. Soft, no tenderness on the patient. I don't feel or see any distension or firmness when I palpate, and that is great. So I'm just going to move down, and I do have to ask you a few questions about your genitals and your urinary state. Is that okay?
Yes.
Is it okay if I look at your genital region?
Yes.
Okay. Before I do that, I just want to know if you've been having any pain upon urination.
No.
Is your urination normal?
Yes.
When was the last time you urinated?
Today.
Okay, great. Anything I should know about this area? Do you have any lesions, things you're concerned about?
No.
Okay. Just looking at it, I don't see any lesions. I don't see anything abnormal. Patient doesn't complain of anything, and so I'm not super concerned about that. And so I'll just cover you back up. If my patient were a female, I would want to know about her last menstrual period and her menstrual cycle in general, but we've got bends, so we're not super concerned about that. So I just want to go ahead and move down, take a look at your legs and your lower extremity. So I'm just going to uncover you, take a look at those legs. I'm still checking skin throughout this assessment, so I'm not noticing any bruises, cuts, or abnormalities, deformities there. So while I'm down at the feet, I want to go ahead and check a capillary refill. And I note that that is less than 3 seconds. I want to check a pedal pulse as well, and that's going to take me 15 seconds. So finding that. Okay, that pedal pulse feels normal, about a +2, which is healthy, and the rate and rhythm matches what I listened to and felt in the radial pulse, so that's great. Now, can I just have you push your feet against my hands? Okay, can you pull up? Awesome. And I'm not noticing any different temperature in the legs than what I felt in the upper extremities, which is great. I'm not noticing any edema when I palpate or when I visually inspect, and that's awesome. So I just want to test strength of the lower extremity in my patient. So I'm going to ask that you push against my hand, depending on what side of your leg it's on, okay? So go ahead and push against my hand this way. Great. And then we'll do the other leg. You push against my hand. Great. Can you push back in? Great. And in. Perfect. I'd want to check for strength of the knee joint. Can you go ahead and bend your knee and push against my hand? Okay. And can you flex against my hand? Great. Same thing, opposite side. So push this way and then push that way. Great. So my patient feels strong in the lower extremity and it's equal on both sides. And I feel like that concludes our head to toe. That's a lot of stuff, so let me just think about it, make sure we got everything. Okay, all right, I'm just going to cover you back up. If you need anything at all from me, your call light is this orange button on the right side of your bed. You can press that, and I will come back for you. I'm just going to go ahead and document all these findings in your electronic chart, and I'm just going to wash my hands and get out of your hair. Okay, thanks, Ben.